Dr. Jennifer Caudle from Sinai is here with more information on the flu. Good morning, doctor.
Good morning.
Before the segment, I said to you, why does it always seem the year I get a flu shot, I get sick right after?
You know, it's probably the most common thing I hear from patients. I ask them if they want the flu shot, and they say, absolutely not, because I'll just get the flu.
Right.
I did last year. The first and most important thing is that you cannot get the flu from the flu shot. The flu shot is made of a killed vaccine, so it actually cannot give you illness.
So it's just a terrible coincidence.
It's a terrible coincidence, and chances are we're getting infected by a flu-like virus. There are many viruses that cause flu-like symptoms, so just because we're sick doesn't actually mean it's the flu that's causing it.
And the doctor actually said you would feel a lot more sick if you hadn't gotten the flu shot.
If you hadn't gotten it, absolutely.
Let's just quickly run down some of the symptoms from the flu.
Sure.
And I'm curious, I know there are a lot of the same symptoms as a regular cold. Is when you have the flu, do you just really know you have it? Is it just really obvious?
Yeah, sometimes it's not obvious to people. I mean, some of the symptoms that you can have are headache, muscle pains, muscle aches, feeling really fatigued, feeling out of it, fever, stuffy runny nose, those types of things. The flu sometimes is a more severe illness. You feel like you can't get out of bed, you miss days of work, things like that, whereas a cold sometimes is a little bit shorter and a little less severe. But of course it depends on the person.
And it's not too late to get your flu shot. And in fact, you should have them. You can still get a shot through the flu season?
Absolutely, and that's exactly what's so important here. The flu season goes from about October to May. October and November are the key times to get the flu shot, because the point is to get the flu shot before you could be exposed to the flu.
Right. I know as an internist you recommend to most of your patients to get one. Who really needs to get a shot?
This is so important. Who needs to get a shot are people ages 6 months to 18 years old. Those are children. And then people aged 50 years and older. People who are sick, who have medical conditions like heart problems or lung problems, people who have weakened immune systems, people who live in nursing homes, or even healthcare workers like myself. Really, quite honestly, it's important for everyone to get a flu shot, but those groups are most important.
And I know it's also important that there's some people who should not be vaccinated.
Absolutely.
Let's run down the list of those. People who have certain kinds of allergies?
Well, sure. The flu shot is made with eggs, actually. So if you have a severe allergy to chicken eggs, that can be a problem, and that's something you want to talk to your doctor about. If you've had problems with the flu vaccine in the past, you really should be very wary of getting another flu shot. And if you have certain neurological problems, neurological disorders, you should be very careful, and you really should talk to your doctor about this. Children less than 6 months old are really not indicated for the flu shot. It's not even FDA approved for children less than 6 months, so they're obviously not the people for this. And if you're sick when you're coming in to get the shot, moderate to severe illness, you've got a fever, don't get the shot. You know, if you have mild illness, stuffy nose, that's okay. But anything more than that, just hold off.
Okay, let's also run down some prevention tips in the time we have left, because even if you don't get the vaccine, or you do, you can still prevent yourself from getting sick.
Absolutely.
Avoid close contact with people who are sick, obviously.
Absolutely. Hand washing is a big, big thing. Hand washing is so important. Hand washing is probably the #1 thing that we can do to prevent illness of most types. Remember, the flu virus is spread by touching our nose and then touching other people or touching objects. The virus lasts on these objects for a while, and other people touch them and we get them. So washing your hands, honestly, is probably the best thing you can do this season.
Another tip you have is, if you feel sick, stay home. A lot of us have the martyr syndrome and we just try to power through it, but you're going to make everybody else sick.
Absolutely, and if you're sick, take care of yourself. Stay home and rest up and get better. It's very important.
Also, cover your mouth and nose when you sneeze. That seems like a no-brainer.
Some physicians I know actually recommend sneezing into the shoulder, or rather the corner of the elbow, so that you avoid using your hands altogether, because again, the hands are a big conduit.
That's a good point. You also mentioned before, washing your hands often and avoid touching your eyes, nose, or mouth. I always think it's so you don't spread it around, but it's because you touch stuff
both ways.
And then you touch your face.
Yeah, you touch stuff and you spread it, so it certainly goes both ways.
All right, Dr. Caudle,
get the flu shot.
Thank you so much for coming in. Well, I already got mine, so I'm all set.
Thanks
Thanks for coming in.